Hi, my name is Kathy Delaney, and I really appreciate this opportunity to talk about a recent publication in the Journal of the American Psychiatric Nursing Association. It focuses on what I believe are nuances to what inpatient psychiatric staff do when they're responding to a potentially violent situation, an escalating situation. In this article that I wrote on de-escalation, what I wanted to do is to try and capture the fact that when staff approach a situation that's escalating, what goes into that situation is really a complex combination of teamwork, leadership from the senior staff and the charge nurse, the kind of intuitive sense of what's going on, what's with this child, different types of aggression, triggers of aggression, and finally, how one uses relationship leverage, I call it, in an escalating situation. Top 10 things I teach novice nurses, and one of them would be situational awareness, and which is, you can teach that intuitive sense. And I was thinking, I worked on the same unit for 14 years, and it happened to be an excellent unit. And one charge nurse in particular on evening shift, the first thing she did after report was walk about the unit and visit every patient that in report had been problematic and get a sense of them. And I always thought it was such a smart thing to do, and then, of course, then she knew exactly where the trouble spots were and what she needed to watch out for and how she needed to be prepared for the rest of the shift. Like surveillance and constant surveillance, everydayness interactions, which I quote in the article that Devereaux says are so important to building relation leverage. All these things look to the outsider like they're just staff is just sitting around, but no, staff are doing their jobs when they're present on the unit, really present. And so I think we need to, we always have to externalize that to people because it's not very obvious. You have to know the different types of violence and where the violence is coming from, where the aggression is coming from with children. For instance, organic children, children with unfortunate fetal alcohol syndrome or trauma, head trauma, they'll like escalate quickly in the middle of the morning in a very shrieky way, and you're really using distraction with that kind of aggression versus a teenager who just feels kind of trapped and they're in front of their peer group on the unit, and they're playing to that audience and there's a lot of bravado. It looks intentional, but it's getting out of control. So you have to kind of have in your mind the different ways that kids escalate. It's really not really diagnosis specific with kids. You're just getting to know those type of patterns. On an adult unit, I think when you've got someone you're not with psychosis that's really not in control yet, say so to speak, and they're escalating, that's different than kind of maybe someone in a manic state. And so you're kind of on an adult unit, you're kind of tracking it the same way, but you might be tracking it a little bit more on diagnosis. I was thinking about that, and anything I've written, it's not so much that I'm saying anything new. I'm just externalizing it and putting labels to it. So whenever I write articles, I'm just hoping that people of say staff say, "Oh yeah, we do that." Well, then let's give it a name. Let's give it some shape so that you can teach newer people. Here's what we're doing here. On a good unit, this kind of teamwork, this kind of leadership, this kind of relational leverage. I think it goes on all the time, but people just don't name it. So that's that's what I try to do in my articles is just name what I see going on very good units so other people will realize why they're doing what they're doing and do more of it. I look at the violence figures right now, and so the rates seem to be going up. So, it's a different time, and I think there's multiple reasons maybe why aggressive behavior or frustration is going up throughout the healthcare system. We need to keep a hold on the other half of our job, which is understanding the person's narrative and being therapeutic and running a milieu with enough structure and support. And at the same time, I think we really need to write articles on units that are doing well with improving their aggression rates. Yeah, I think that's what we need right now.